So, without any further delay, let's dive into the virtual sea of knowledge and exploration. So, sorry for the delay. So, note to the attendees. Attendees, you will have an opportunity to interact with the expert speaker and get answers to all your questions, or else you can post your questions in the Q&A or in the chat box, or else you can raise your hand so that I will allow you to talk. So, let's start the session today. Greeting and a warm welcome to everyone joining us from the various concerns of the digital realm. Let me introduce the speaker of the day, Dr. Daha Bipin. Today we are going to discuss about the topic recent advancements in the field of radiology. So over to you, Dr. Daha.
Yeah. So recent advances, if you people see, they do ask quite a few questions in FRCR and especially in the step 1. Although you will find questions related to it even in Viva sometimes. As I remember, in step 2B, they have asked at the end of the case discussion, what do you think is the role of artificial intelligence in radiology in today's era? So you people might have heard people discussing about artificial intelligence a lot, of course. And because artificial intelligence relates to computer, it naturally has a huge role coming up in radiology as well, because radiology is technology-based science. It is absolutely technology-based because depending on the technologies, we image our body. It is machine-based science. Machine-based science. It is not only pharmaceutical-based, or it is not just, say, blood examination-based. It is actually imaging body with machines. It needs human brain for sure, because you should know how to image, first thing. Second thing, you should know, once you get images, are they correct? And third, you should know how to interpret. And fourth, you should know how to come to an inference. So without human brain, this is not possible. Now, one would argue that all this data, how to take an image, is the image correct, is how to come to an inference and to a conclusion, we will feed the data in computer and computer will do it for us. Yes, that is what artificial intelligence is about, but it cannot do it without human assistance. So artificial intelligence has a very unique and upcoming role, but it cannot completely replace radiologist. It can never replace, for that matter. It is going to help a lot, and I will show you how it helps. So anyone amongst you works in a hospital where they take help of AI in radiology department? Do they take help of AI in any department for that matter? Say medicine, say surgical branch, say robotics. Anyone came across artificial intelligence being used, or anyone amongst you have come across a study being done at your hospital, at your college, at your institute, where they are studying the role of AI on the subjects? Yes. Anyone amongst you? Probably not. Probably not, because still it is in developmental phase. So radiology has many modalities, as you people know. The basic modality is radiography. Radiography means taking X-ray of the body. As you know, radiology allows us to image our body and depict the various illnesses or various diseases. So we image our body. We know how palm looks on MRI. We know that MRI can show all the phalanges, all the metatarsals, all the carpals. It can show extensor tendons, it can show flexor tendons, it can show flexor retinaculum, it can show the carpal tunnel, and then it can show the various ligaments, tendons, synovium, menisci, cartilage, fascia, bone marrow, bursa, labrum, everything. So imaging is something that shows a particular part of the body. X-ray particularly show the bones, although it is unidimensional. But in many cases, X-ray suffice because they give a good idea with low radiation dose. We cannot do CT scans, which also uses X-rays for everything because it is three-dimensional unless indicated. So various modalities that we have are X-rays, which is now uses X-rays which are ionizing radiation to generate the images of our tissues in the body and then interpret it. For example, an X-ray of a wrist, which can tell you about fracture of the carpals, lower end of radius, ulna, metacarpals, like that. Then comes CT scan. CT scan is nothing but taking X-ray of the body in multi-dimensional. We hit X-rays in radiography from one way, from one dimension. In CT scan, especially with the multi-detector CT scans available today, we image our body with X-rays from all the aspects, 360-degree, so that we literally get cross-section of our body without invasion, of course, without any intervention to the body, unless we want to do a contrast study. Unless we want to do a contrast study, and we want to do a contrast study when we want to image vessels. CT scan cannot show vessels without contrast. We want to use contrast when we want to detect a infective or an inflammation focus. A plain CT scan may not always show it. When there is inflammation infection, the vascularity of that part increases. So when you give contrast, that part enhances. You might have read in Robbins pathology, Kaller, Ruber, Dollar, the 5 signs of inflammation. So one of the sign is increased vascularity. Contrast is required for detecting infection inflammation. Third, where we use contrast in CT scan is tumors. Not all tumors are seen on plain scan, or not all tumors can be characterized on CT scan. Plain, we need IV contrast. So we give IV contrast. Inflammation, infection, tumors, vessels. When you want to see vessels, we have to use contrast study. This data, what we do is we feed in computer. So when a case will come to our department, we will feed the data to computer. So when computer, with the help of AI, what it will do, AI will analyze. Artificial intelligence is nothing but computer-based program. It will analyze. The indication is superior mesenteric artery thrombosis. So when you will know this is the indication, the computer will tell automatically that this patient needs contrast and non-contrast study. So the receptionist will automatically enter, with the help of AI, the appointment is for contrast and non-contrast. And AI has the data, what is done to be done for contrast. So immediately receptionist will take the option of contrast and will come a pop-up up showing that, yeah, I need to tell patient because I'm giving iodinated contrast. We use iodinated contrast in CT scan. So we will know, the receptionist will know the pop-up that yes, patient has to be 8 hours fasting. Patient should be fasting, otherwise contrast can cause vomiting. Patient should not have any history of allergy. So we know patient should not be diabetic. If diabetic, no problem. But patient should not be taking metformin. If taking something else than metformin, not an issue. But metformin can cause lactic acidosis when you give the IV contrast. So let us avoid metformin for 12 hours. So these pop-ups will automatically come. So it reduces the job of individuals because AI will automatically detect what study is, what study it needs, what are the instructions to be given, and patient will have a clear-cut guidelines. So this is how I will show you ahead AI can help us. But you cannot think that AI will give appointment. AI will decide what if there is some error in data feeding. Suppose a clinician doesn't mention clinical indication properly. AI will not pick up the indication properly then. And then you may go with the wrong study. So without human intervention, 100% AI dependent things in radiology are not possible. Similarly, a Doppler or ultrasound, where we use ultrasonic waves to detect various organs in our body and the diseases without ionizing radiation, of course, because here we use what? Ultrasonic waves, which are free of ionization. That's why we do, and we can do ultrasound in pregnancy many times, no issues, no harm. Then comes MRI, which is another powerful tool, and it is so powerful, it can image our body, especially the soft tissue. The disadvantage of CT scan is it cannot image soft tissue. It cannot image soft tissue well. MR has exquisite, exquisite, amazing soft tissue resolution. So it can detect soft tissue lesions very nicely. MR is very good for soft tissue, including muscles, tendons, synovium, menisci. Very good for soft tissue, ligaments, soft tissue. Very good for soft tissue, MRI. Now, this data we feed in computer, and then the artificial intelligence program knows that this patient has come for suspected soft tissue tumor of tibia. I'm sorry, of leg. So it knows appointment is to be given for MR with contrast. So AI is going to aid us like this. Fluoroscopy is nothing but multi-dimensional X-rays. So you can take fluoroscopy between X-ray and CT scan, with fluoroscoping having an advantage which CT scan doesn't have, which X-rays doesn't have. Real time. You can see things happening real time. So fluoroscopy is nothing but live X-rays, you can say. CT scan is three-dimensional X-rays. And fluoroscopy is live X-ray. Sometime we need it because you people want to see the dynamics of activity. Like you want to see the phases of swallowing. You want to see the act of swallowing. You cannot see it on CT scan easily. Act. Because the images are static, but in fluoroscopy, they are real time. Now, when computer knows that patient has come with functional dysphagia, the AI will give an appointment for barium fluoroscopy study. Like that. So this is how now bone densitometry. Bone densitometry is what? It's a study where we use X-rays, but very low dose X-rays, very low. If you see in millisieverts, per DEXA study we do, patient gets around 0.05 millisieverts, very less dose. And then we have a system, Z score, X score, and we come to know the bone mineral density, BMD, DEXA scan. If you have seen, DEXA is a very old thing. If you have seen movie, The Pursuit of Happiness, in Pursuit of Happiness, that gentleman, the Will Smith or something his name, he roams around New York, and for his daily living, he sells densitometer, bone densitometer. But in 80s, it was very coarse. Now we have very advanced, very fine, very low dose, very much automatic. With aid of AI, you can even calculate BMD perfectly, and that is DEXA scan. So thus, what I'm trying to tell you is we have various modalities. With AI, we can do things better. How? I will show you now. So these devices help in diagnosing, follow-up, and even a treatment follow-up and to see for recurrence and all. Okay. So how you define artificial intelligence? Artificial intelligence is a process by which computers or computer-like machines can actually demonstrate human-like behavior, human-like cognition behavior. Because what are we going to do? We are going to feed the data in computer how exactly breast carcinoma looks on mammogram. So when you feed that data, when a computer will see an image of breast mammogram showing a breast cancer, with the help of this programming called artificial intelligence, it can know this mammogram is normal, this mammogram is showing a lesion which is BIRADS category 4, probably carcinoma. So what will happen? Suppose you have a huge number of cases. You are running a, say, breast cancer awareness screening program in month of October. What you can do, you are going to do daily 500 mammograms. So with help of AI, see, AI cannot tell you 100%, but with the help of AI, it is for sure the more data you feed, the AI becomes more intelligent and can filter out that yes, out of 500, these 491 cases are normal. 9 cases have lesion, which are suspicious of category 4, BIRADS category 4. So then those 9 cases, we as a radiologist will see properly and concentrate more. So the job becomes faster, easier, and we are sure that in these 9, we have to be meticulous. So the simplest and oldest form of artificial intelligence are the rule-based computer algorithms that produce rapid calculations. Now you want to calculate the DEXA, I mean the Z score and the X score of bone mineral density, or you want to calculate the lower limb length. Is the length of both limbs correct? Or you want to calculate the fibroelasticity of liver, or you want to calculate the volume of liver. So when you feed a data of around millions of patients in computer knows how to calculate, and then with the help of this programming, you can, so simplest and oldest form of AI are the rule-based computer algorithms that can produce rapid calculations, data inquiries, and answer to common questions. Any common, when you Google, for example, AI is going to help you to answer. And these methods are referred as symbolic AI, expert system, knowledge graph, excuse me, or old-fashioned AI. So this is very basic. This was started, say, 71, 72, where the simplest form, where they feed the data in computer and rapid calculations, data inquiries, data queries, and common questions were answered by using symbolic AI, expert system, knowledge graphs, or the old AI. Now, the recent form of AI is something which we are going to use in radiology. And the most advanced and recent form are based on the neural network. What is neural network? See, neural network means the cognitive behavior of a human or a radiologist. So more advanced form of AI is used in radiology department, which is based on neural networks, which means architectures that are loosely modeled after human nervous system. So literally, it works as if human brain with respect to radiology. And these neural networks help to develop softwares which are based on machine learning and more complex thing called deep learning. So these, if you see, when you people will get a question in exam, you will see these words coming up: neural network, role, radiology. Because radiology things are more complex, which the computer has to understand and develop a software by using literally human cognitive behavior, which is now possible because we have developed neural networks like machine learning and more complex things like deep learning. Okay. So this is a technical thing. This is a very good example. See, what can artificial intelligence do? It can help in all the processes in radiology. It will really help in all areas of a CT scan, MRI. All areas means what? I told you earlier, just a while back, it can help right from assessing the indication and patient scheduling. When a patient is sent, once we know what is the indication, and computer AI will schedule it with a correct procedure. AI can, without, right now what happens, a human has to exactly position, take proper, you have to program properly. From chest means you have to take from the thoracic inlet up to the dome of diaphragm. So you have to plan it. But if you feed this all data, that chest means scanning from here and here, AI will help even in acquisition of the images. And once you get the images, AI, right now what happens when you do example cardiac MRI, you as a human, as a radiologist, you have to reconstruct the heart and you have to avoid the breathing things and take a without motion image. AI will do it automatically. It will reconstruct the images with very superior quality, no motion artifacts. And then it can even help in, suppose you have done a cardiac MRI. You want to know which part of heart is having ischemic zone. So the next step also MR will help in, and that is called segmentation, quantification, and randomics. Because with random studies, it will come to know what area is normal, what area is not moving properly because of ischemia. And then even AI can aid in classification and reporting. Classification means, for example, you want to know, is it a class 1 ischemia, class 2 ischemia, class 3 or class 4? And plus it will help you in reporting exactly, is the ischemia in left ventricular wall, right ventricle, where is it? And eventually it can even tell you about prognosis, in the sense, will the myocardium survive, will the even that. So see, such a aid, because of computer software we can do it. So we can have a computer detection of the disease. Automated image segmentation means splitting up the images properly. Extraction of the features, randomics. You can extract the feature. Is the image has a ischemic zone or no? Data mining from large patient cohorts means when you want to do large studies, automatically AI can uh, take out the data and tell you that this is the data. It can reduce the noise, motion artifact. It can thus improve the image quality, help in even voice recognition and structured reporting. Suppose I want to dictate report. AI can make it more smooth, although we have softwares now. But with AI, that can be even more structured and more proper. And thus, the highlight of AI is in radiology, in all modalities, it can literally optimize the workflow, complete workflow, right? From giving appointment scheduling up to telling the patient prognosis, AI can do it. This is how it can have a huge impact, although it cannot exclude a human hand. Okay. So presently, if you see some institutes in America are using AI, say AI is a technology that uses computerized algorithms, which are step-by-step procedures for calculation, data processing, and responding, reasoning and responding. Information is gathered over a time. See, now I was working on a project where these people told me, see, this is how AI is done. Huh? These I had a contact with a company in Israel where they told me that they are going to send me every day 25 MRI of the prostate. And what I am supposed to do is only outline, I should outline the capsule of prostate. If any lesion is there, which is breaking the capsule, I should take the cursor out. So what I did is 25 cases daily I used to do. I did it for around 6 months. Of course, with some of the gaps, some of the breaks. And I did so many cases. So what they did, they gathered the information and they fit it in computer and they made an algorithm. So AI, when a MR prostate is done, can recognize this is prostate. This is the capsule. This is a tumor invading the capsule and going out. So machine learns it by using a large amount of data and makes an algorithm for us. Information is gathered over time to form algorithms that will achieve the best possible outcomes. And that is the essential part of machine learning. Understand? See, you cannot have AI automatically computer software generated. You have to feed data to form an algorithm. And then you can solve a case. Regarding radiology, the computer code written based on the algorithm will take the medical images as a data input and return the answer to radiologist with their analysis. Understood now? When you feed the data and make algorithm ready, the computer will take the data of MR prostate and will tell you this is the prostate, this is the analysis, this is the tumor, this is normal. That is how it can help in interpretation, the most important part. So thus, what are the benefits if you see in radiology wise, means to the radiologist, okay? Greater accuracy and specificity is possible because they can pick up the abnormalities. If suppose we are tired, we may miss it, but computer will pick it up. Greater accuracy and specificity. It helps in picking up repetitive tasks. See, these tasks typically involve a lot of data that radiologists would generally have to do, but they can now spend their time on focusing important areas and the repetitive, like when you do MR prostate, you have to calculate prostate volume. So why to do in every case? Computer will tell you this is the prostate volume. You don't have to use even a cursor. It also helps to find out subtle lesions. And this is especially useful when the radiologist may be tired or distracted by other things. Subtle lesions AI can pick up. AI can provide a second opinion by analyzing the patient's results. Suppose I have given an opinion there is a prostate cancer, PIRADS 4. So AI will tell that no, it is PIRADS 5 because it has advanced and gone into the surrounding structures. So AI can give a second opinion as well. Okay. Now, this is one of the simple thing which I found on internet and which I really loved because this is one of the study where a huge amount of people were taken into account and it came to conclusion. Artificial intelligence using Google's DeepMind algorithm can detect breast cancer more accurately than a real doctor was, it was said. There is a Google's DeepMind algorithm, which is an AI-based algorithm. These findings can come through research from Imperial College of London. Google, they did together, where they trained computer to spot abnormalities in mammograms of 29,000 women. And then this study actually came to a conclusion that if you feed the data, our AI can detect even a bit more than real doctor. Although these are occasional studies which are not every study is showing this, but yeah, this was a positive impact. So AI can facilitate a radiologist's work and improvise in detecting subtle lesions, better way, and even making it faster and avoiding repetitive work which is done by radiologists and waste of time can be saved. Increasingly, medical imaging is becoming part of diagnostic chain. So it is important that the end goal of AI is to be same as radiologist so that it benefits the patients more. Yeah. So this is a very good graph where if you note, follow the AI, they are saying the performance of AI can be even better than human. That is a future outlook, that it will exceed human behavior if more and more data we start feeding up in all the fields in each and part anatomical part of our body. So early efforts had a subhuman performance. See, early efforts, if you see the part of initial part of graph, it was subhuman performance. But currently what is happening? The subhuman thing has gone and the current state is it is almost equal to human. And a day will come when it will exceed the human results. General AI will exceed human performance and reasoning in complex tasks especially. Now they have given the examples of novels and surgeries, but in radiology also it can help. Okay. So yes, this is the conclusion, which is very important. And we should know that deep learning and machine learning are the two parts where we use the neural networks and the cognitive behavior of a radiologist is fed in computer and it starts detecting the things, programming the things, coming to conclusion, prognosis, subtle lesion detection, and many things. Okay. And plus, it will save time of radiologist. You don't have to waste so much time, especially when you have more work. So timing is very important for health, and giving a diagnostic earlier, the diagnostic inference earlier, and could make a great amount of difference in patient's life. Computer can process large amount of data, allowing them to perform analytical tasks beyond human capabilities. Okay. So the question remains, could the future of AI development radiology be the factor that saves numerous lives? Can AI replace radiologists? These are the two main questions which are actually hindering in human mind. But yes, it cannot replace, but it is going to aid. And maybe where there was work of 10 radiologists, it may reduce to 8, but it cannot completely replace. Plus, yes, it is definitely going to save more lives, because more the data you can have more better analysis and can come to a better conclusion and a better impact on human health. So here you should remember the neural network, how it is mimicking the cognitive behavior of human and coming up with deep learning and machine learning, and coming to what is called as the artificial intelligence, almost going beyond human capabilities and coming up to help saving many lives by diagnosing even earlier. One of the very good example was that study which was done by Imperial College of London with Google, where they did a study of mammogram on 20,000 women, and they found that AI can detect a bit little better than even human the uh, cancers, breast cancer example. Okay, that is all. Uh, Now you people can ask me if you have any question in your mind. Anything, whatever. It may be AI, it may be whatever you feel. You can please ask me.
Attendees, you are requested to ask your doubts. So, any other doubts from the attendee side, you can post your questions in the Q&A, or else you can raise your hand so that I will allow you to talk.
You can even tell me in recent advances, suppose we do it next time, what topic you people want. Like suppose someone would say, I want to know more about radio frequency ablation. Or someone would say, I want to know more about perfusion studies in brain. Or someone would say, I want to know more about the, what you call, say, cone beam CT scan. Or someone would say, I want to know what is dual energy CT scan. Whatever, you people can tell me the topic and I can cover it. Especially when you read for FRCR, you come across some difficulties, especially with regards to the recent advances. You can tell me that topic. Otherwise, I'm going to try to cover the topics which are asked in our FRCR exams.
Any other questions or suggestions from the attendees end?
Shivani, Nishant, Dr. Shivani, Dr. Nishant, Dr. Sufia, Dr. More, Murmai More, Naveen. I can see 5 of you people here. Yeah, Madam Pooja. Hello.
Yeah, yes. I think Dr. Sophie had responded that New Era Hospital, Navi Mumbai.
Okay. Actually, I was not able to hear. Uh,
Okay, I will allow her to talk.
no
Dr.
problem.
Sophie, you can talk.
Good morning, sir.
Good morning. Yeah, good morning.
Yeah, it was a nice session.
Thank you. Which hospital?
So I'm in New Era, Navi Mumbai.
Okay. Good. Okay.
So I had a question. How many more years to go? Because this is all in a trial phase. So
Yeah.
till so
AI being
when
applied in
will
a common
yes.
life, a common radiology center,
Yes, sir.
it should take another 10 years maximum, because the data has to go to computer and then they
Okay.
will generate the software. So maybe another 10 years.
Right, sir. Okay.
Yeah.
And the one scenario when you told me that you had registered a prostate size for
Uh,
15 per day, right?
yeah.
S- So the number of imaging done, the more the data is entered, the more accuracy will be there.
Correct. Perfect. Yes, that's what. That is why
Right.
this process is going to take time.
Right, sir. Okay.
Yeah, correct. Yes.
Okay. ठीक है. Nice
Oh,
talking to you.
sure. Thank you. All the best. Yeah.
Okay.
So, any other questions from the attendees end or any other things to be shared, you can. And attendees, the polls had been launched. You are requested to attend the polls. Kindly participate in the polls. So, hope there is no any other questions from the attendees end. So, by this, we will end the session. Thank you for joining us for the today's session.
Okay, bye then. Thank you.
Yeah, thank you, doctor. Thank you
Yeah.
so much. So, attendees, you are requested to take participate in the polls. Kindly fill the polls and leave the session. So, thank you so much for your participations.